Hello everybody, welcome again to my Friday video blog. It's Dr. Saydyk from Stoneridge Dental in Gilbert, Arizona. Today's Friday, April 1st, so happy April Fool's Day to everybody. What I wanted to talk today about was dental plaque. Now, dental plaque is something that we all hear about and we all kind of know about from commercials, and maybe I or the hygienist have said it to you, but do we really know what it is? Let me give you a little example. When you wake up in the morning and you feel your teeth, or after you haven't brushed for a while, you run your tongue around your teeth and you feel that fuzzy feeling like your teeth have little sweaters on them. Well, that's dental plaque. So what's it made up of? A lot of people, when I ask them, they'll think it's food particles or water or mucus or some spit. And while all of that's in there, the real prime component of dental plaque is bacteria, and that's what makes it. So when you scrape your tooth like that and you see that little white material, that's all a bunch of bacteria. Of course, there is saliva, food, and mucus caught in there, but the main ingredient there is going to be bacteria. This bacteria is in your mouth all the time, and it's always there. You need to have it. Now, when we're born, some people ask me, where does it come from? When you're born, you don't have any bacteria in your mouth, and you get that bacteria when you first are born, and then when you kiss your mom and you share utensils, and later on in life when you play around with the dog or get something off the ground, and then even later on in life when you kiss your loved ones or your husband or spouse, you're sharing bacteria, and that's the way we kind of inoculate ourselves with this. Now, in our mouth, this bacteria floats around in these great big puddles, and not single bacteria floating around. They have all these big spaghetti arms hanging off them, slimy spaghetti arms, and they attach together in groups because it's safer in numbers. So these big blobs of bacteria are floating around in your mouth, and if you think about it, it's kind of dangerous. You drink some water and it goes down into your stomach. It gets destroyed. It could be spit out. I mean, lots of things can happen. So this bacteria wants to attach to something in a safe place. So they gather together in these big spaghetti slime balls, and they attach to your tooth with all this little super glue and this really sticky slime. And then more bacteria will attach to those big slime bubbles onto your teeth, and they kind of start to solidify together. Then they'll mushroom out and they'll spit off little big balls of bacteria to go attach elsewhere and roll down your tooth. It's a very active thing, this plaque. You'll know this if you haven't brushed your teeth for a while. It can go from a little piece to all of a sudden coating a lot of your teeth in one area. But we don't see it because it's white and it's microscopic. You can feel it though. Now, this bacteria eventually will calcify. It'll start to get all the calcium and all the minerals from your saliva and build up these little hard protective layers on it. You're going to call that tartar, and I'm going to call it calculus. And inside that are channels where it actually runs food through, and it's a living, breathing organism on your teeth. They're producing toxins. They're producing acids that dissolve into your teeth and cause your gums to become infected. So it's actually a pretty serious thing having this dental plaque on your mouth. And we're going to talk about that more later, the way your body reacts to the infection that this dental plaque brings into your mouth. And we're also going to talk about how our sugar consumption has played into that. But those are going to be on our next our next video blogs. Don't forget to enter our Kenny Chesney concert by sharing this video and sharing our other stuff to your friends on Facebook, and let us know that you shared it with them. Put a little special message in there, always makes it a bit nicer. It's 2 tickets right up front to Kenny Chesney, only 1 month left to go before we give those away. Again, thanks for coming and visiting me today at Stoneridge Dental. If you ever have any questions, let us know.